The three main areas that we use Botox for cosmetically are in the forehead, the horizontal lines, in the frown area, and commonly called the 11 lines, and the crow's feet, so the lines that come round here. And the crow's feet can be quite a early sign of aging in the face, and it's a very effective treatment for the crow's feet, and also in preventing the lines and wrinkles from getting worse in the future. We also use it in the lower half of the face for more subtle treatments. So for example, as we get older, we get the sort of sad face where the corners of the mouth start dropping down. And Botox, used subtly, can just help to neutralise that or lift it slightly. And also for what we call the gummy smile, where when people smile, you can see a bit of extra gum just above the teeth, and Botox can just relax that down so it's not so obvious. In the neck area and in the jawline, we can do something called a Nefertiti lift, which helps to, again, just improve the jawline appearance and lift it up a little bit. Also in the neck, what we call the platysmal bands, or the turkey bands, which are commonly known as. A few injections on either side can really just soften out those bands and give the neck a much smoother appearance. Non-aesthetic applications, so clinical applications. Botox is used for chronic migraines, teeth grinding, which is also called bruxism, and hyperhidrosis, so excessive sweating in the armpits, in the forehead, in the hands, and also the feet. It works very well. It lasts for up to 6 months, so cosmetically it can last up to 4 months, but clinically in sweating it can last longer. We tailor each consultation for our patients. We try to achieve a natural look with our patients and give a natural enhancement. At Botonics, we try and do a natural treatment to start with, and we review our Botox patients after 2 to 3 weeks, and we can make minor adjustments if required. We don't try to make our patients look frozen. We just give them a natural enhancement. Botox is relatively safe to administer. The most common side effects include bleeding, bruising, swelling. There may be a bit of redness. Some people complain a bit of a headache afterwards. There are very minimal long-term side effects, if any at all. Most side effects last for a few days and generally settle down. There is a very low chance of any systemic risks of Botox. Over the last 30 years, there is very little information in literature or evidence to suggest that there is a systemic problem after Botox administration. Botox is designed to be injected into the muscles just underneath the skin. However, there is a small chance it could be injected into a vein. However, the doses of Botox which are used cosmetically are incredibly low and get broken down by your system very quickly. So there's a very, very low risk of any systemic problems from Botox treatments. There is no documented long-term effects from Botox. There is no evidence to suggest there are any long-term effects from Botox. However, some people may notice that there is movement in other areas of their face. This is not because of the Botox, it's just that other areas then become more obvious and more noticeable. Botox treatment usually lasts about 3 to 4 months on average. We can never tell exactly how long it will last for each patient. We have noticed over time with repeat treatments the effect seems to last longer, and the lines certainly get better over time. Botox doesn't work immediately. After the initial injections, there won't be any difference. It takes a few days to start working, and the full effect takes 2 to 3 weeks. And that's why we review our patients after that time to make any minor adjustments. You're entitled to come once a year, that's absolutely fine. However, if you wanted to maintain the results over time and get a general improvement over time, then we would recommend usually coming 3 to 4 times a year once you've noticed the Botox wearing off. I don't believe in teens having any treatment. However, in mid to late 20s, it's a good preventative treatment. And we have noticed over time, with people having Botox in their 20s, over time their lines have improved or stayed away in their mid-30s. There are some exceptions with late teens who have naturally wrinkly foreheads, and I think it's acceptable with appropriate consultation to administer Botox. My approach to treatments is a evidence-based, practice-based evolution over time. So I've treated thousands of patients and noted minor differences in each patient, and therefore I'm able to tailor my treatments which are better suited for each individual rather than just administering a standard amount for each patient. And we tailor our treatments for asymmetries and their desires of what sort of results they want to achieve over time.